Welcome, Lipstick and Logic. This is episode number 6. I am Logic. This is Lipstick.
What? I am Logic naturally, and you are Lipstick. Which, by the way,
Lipstick, please.
Let's do a lipstick check. You obviously forgot to wear some.
All right, so can we do a lip balm check or a lipstick check, as you would say?
Let's do it.
So I just presented recently on fillers and facelifts, and it is a controversial topic. I presented at both a dermatology conference and a plastic surgery conference. It's a hot topic right now. A lot of surgeons are out there saying that fillers make the facelifts harder and more difficult, and a lot of people are coming to my practice now saying, Dr. Dayan, I wanted to get a filler, but should I just get a facelift? And you're seeing a whole slew of people coming in getting facelifts in their 30s now because they don't want to get fillers. I mean, it's really an unusual time. What do you think about it?
So I guess my biggest question is, all of a sudden, this is an issue. So has the skill of the people performing facelifts changed? Because fillers have been around for over 22 years, right? First approved in 2003. So yeah. What's changed? Is it like that people with residency hours cut, people aren't getting as many like surgical hours, and so perhaps they're not getting the caseload that it would take in order to be able to feel comfortable? Or are people just not even doing revision surgeries? Because I would probably bet that it's harder to do a secondary facelift on someone than it is to operate on tissue that has had previously been filled.
All right, so when you have fillers in the face, especially depending where they are and what kind of fillers are done, you can oftentimes detect that when you go into surgery. Now, does that increase the risk of having a bad outcome after surgery, or not getting, or risk of a complication like an infection or something to that nature? I don't believe so, but there are reports out there. So we should comment on that. There was a large study that was done. It was a survey done in the plastic surgery literature, surveying, asking plastic surgeons, do fillers increase your complication rates, or do you get worse outcomes because of fillers? And there was a little bit more of a majority of patients, physicians that were surveyed said yes, that it makes the surgery harder and it increases complication rate. Now, that was one survey. The response wasn't that high. I think it was 150 response or something like that. It wasn't
so
that many
150
people.
It was
this.
something
like that.
Okay.
It wasn't a huge response.
So that's important to keep in mind, because how many surgeons are in the United States?
Like 6,000 or so.
Okay.
So it wasn't, I think it was 157, I have to look, but it wasn't a lot. It was certainly not more than 300 people that responded to it. So that paper gets cited often. And a lot of doctors are on social media right now, and there gets a lot of clickbait to say, don't get fillers, and they're scaring people away from fillers.
But that's interesting, because then there's like also, like, let's bump up the jewels here, right? So there's a paper, because they're bumping up. I'm obviously, getting a little riled, because I've been injecting for over 18 years, and this is all of a sudden just like a trend like anything else. And so I've never seen any surgeon say that it's hard to do a secondary facelift. Do you do facelifts for the second or third time in people?
Yes, and there's always a little bit of scar tissue. And in fact, I will tell you something, that you get better results oftentimes the second time around, because you have 2 layers of scar tissue or fibrous tissue, and they seal down a little bit better. Sometimes they have a thicker membrane to pull on.
Yeah.
So, and there's a paper by Jerry O'Daniel, and I think it's a great paper that it doesn't get cited often. He published on patients who get PLA or Sculptra before surgery and
over
after
114 subjects that he actually published on.
Before surgery and after surgery.
Right.
And the majority of his patients ended up getting it before and after.
Right.
And he thought he got better results with it. And no one talks about that. Now, it may be based on where it was placed, and he says he did a lot of the injections, so it was placed down near the
right
mass
place.
or near the layer of fibrous tissue that we pull back.
Right.
So maybe it thickens that up and makes it a little bit easier to get a better result. So that could be a portion of it. But needless to say, these patients are getting treatments before and after, and it's just part of their continuum of making their aesthetic journey better.
Which we'll cover, because I actually had to retrospectively look at 20 of my patients who have undergone facelifts after, on average, they were getting injected by me for 7 years, and we'll talk about those results in a moment. But it's amazing that it's convenient that papers like Daniel's are not necessarily cited, but they're actually large studies covering over 114 patients where they are injected. And if the average age of a facelift, which I think has probably changed now with the trend of 35-year-olds getting facelifts, has shifted. But for the most part, we'll say that the average age is in one's 50s. And we know that in one's 50s, if the majority of these people are women, they're in menopause, and skin gets thinner during menopause. And it's not just skin, it's everything that's made up of collagen. And so that includes the fibrous tissue that makes up the SMAS, which is this tissue that many are, promoting is these deep plane facelifts and potentially what's being pulled and sewed. If that tissue is very friable or thin, I agree with Daniels that perhaps getting it thicker would lend to something to actually suture better and perhaps less reason to have dehiscence or an opening of the wound, perhaps less of a reason for the surgical scar to get wide, which I laser a lot of those scars in my practice, and perhaps better reason to actually have a longer lasting result if you have tissue that you can hold on to better.
So I think there's an argument to be made for that. But I will tell you, like if someone's had a lot of radiofrequency treatments or ultrasound treatments, it's a little bit more tedious to lift the skin flap when we try to get below. Now with deep plane facelifts, you don't lift as much of the skin flap as you're going right deep down into a deeper plane.
Right.
So that doesn't make that much of a difference. And once I get in the deeper plane, usually it opens up very easily for me, even if they've had previous radiofrequency and ultrasound
because
treatments.
filler shouldn't even be injected underneath the SMAS in front of the ear.
Right, in front of the ear.
So in front of the ear, which is where you guys are really dissecting and pulling, filler shouldn't even be in that plane underneath the SMAS if people are really doing these deep SMAS.
Okay, but we're going deep below SMAS even more centrally on a lot of these patients. But having said that, those planes open up for me pretty easily. It's rare that I have a problem there from someone who's had filler or radiofrequency treatments or energy-based devices. Now, if they have a scar there or they've had a previous bad infection, that actually causes more of an issue than if they've had fillers or
right, like a skin cancer, which the incidence of non-melanoma skin cancers on the face especially is rising. And so people are getting those scars. I mean, does that ever tell you, would that be a contraindication to getting a facelift?
It's not a contraindication, but I work around it when I'm doing the facelift.
Right.
So bottom line is, I don't think this should prevent people from getting surgery. I don't think they should be afraid to get fillers or other aesthetic treatments thinking like, well, I can't get a facelift in the future. I think that's a lot of
fear-mongering.
Fear-mongering, yeah, it really is. Like I think you can get a great result regardless. And if I have to work with the filler, I work around it, or if I see it there and I can take it out, I take it out during surgery, and I think my results are still very good.
So just because I always like to support the things that I say with evidence, not just my N of 1, we retrospectively looked at over 20 of my patients that had or undergone a facelift. Of those 25 were actually undergoing their second facelift because, yes, they still see me after their facelift to get fillers and neuromodulators because you continue to age, so that's not a newsflash, right? And so what we found was that on average, for 7 years, patients had been getting either Sculptra or biostimulators or hyaluronic acid fillers, or as well as even microfocus ultrasound, and they went and they got a facelift. And we retrospectively evaluated them and asked them, did you have any infections, prolonged swelling, scarring that required, revisions or laser surgery, and none of my patients had any issues. What was interesting, and perhaps what's not necessarily highlighted in some of these fear-mongering posts, is that at a year, patients were already requiring hyaluronic acid filler.
And
And at a year and a half, they were already requiring or asking for. I wouldn't say requiring,
they were requesting.
They were requesting, right? Because there was volume loss that was taking place because these procedures don't stop you from aging. And so we have to remember that. And so sometimes people just choose, like, I'll just do a facelift with this preconception.
Yeah, it's one and done.
It's one and done, and it's not. So at a year and a half, they were already getting PLLA done, or their biostimulator, and at 2 years, they were already noticing some level of laxity along their jawline that was requiring microfocus ultrasound. So it's fascinating to me that that's not talked about as much as dissecting and showing filler, which might make a really good Instagram reel.
And I present this to surgeons a lot, and I think you remember this, but I wrote a paper a while back showing that 42% of my patients that my first 5 years of practice started out non-surgical treatments and got a surgical treatment.
Right.
And in your paper, you showed that I think it was 60% or so came back within the first year or year and a half to get another treatment. So what you see is these patients are getting facelifts and they're getting non-surgical, both before and after. So if you're a surgeon, I would say to you, keep these patients in your practice. Like, take care of them holistically. If you think they're coming in for a facelift and then they're gone, that's not good for your practice either, because these patients keep coming back. You can maintain their care. You can maintain a great relationship with them. You can help them on their aesthetic journey, and surgery is just one part of it.
Yes, I mean, I would say I know your facial plastic surgeons. Have a really good oculoplastic surgeon that you refer to. Perhaps not one that thrives off fear-mongering, but one that recognizes that there's a place for surgery and there's a place for non-surgical procedures. And I definitely recognize that I can only do so much with my non-surgical procedures. And that's why I love to refer to my surgical colleagues, because it's recognizing what your limitation is where the expertise lies, right? As much as being honest about what can be accomplished with your expertise and being forthcoming with your patients, so that people don't have a misconception that they need to have a facelift at 35, because otherwise the fillers are going to migrate or move or look weird, or they're not going to be able to get a facelift if they do anything to just make them look good and feel good.
You know what's interesting? I look back at the historical data of how many people are getting facelifts. You know, it's not changed in 25 years. 1997, the same amount of people are getting facelifts in this country as there are in 2025.
The same amount?
Same amount.
The percentage or
no,
the end?
Absolute number.
The absolute number.
I think it was 96,000 and it's like 97,000, or it actually went down I think a little bit now. It's like 99,000 on 96,000 people reported according to ASAP's data. And that's
even though the population has gone up.
Yeah, but
so
if you look at fillers have increased 10 times, facelifts have not increased at all. But facelifts went down when the filler craze came, then they started creeping back up, and now you're seeing fillers coming back up. Facelifts coming back up. So fillers had a big dip, but then after COVID, they started coming back up. 23, 24, you start seeing increased numbers of facelifts coming back.
Okay.
So facelifts went down, now they're coming back, but still the absolute number of facelifts is the same as it was in 1997.
So if I was doing a data analysis on that, I'd probably tell you, with the population number increasing in that time, that fillers and devices probably have a role, and they've kept some people from needing to do a facelift.
But if you're a plastic surgeon, you want to do more facelifts, it's in your benefit to talk about these things.
So it's in your benefit to basically fearmonger.
No, not fear-mongering. To highlight what they do. I don't want to say that because there's a lot of people who truly believe what they're saying, and I respect them for what they're saying. I just think that we have to take it with, it's like doctors all have expert opinions, and
of course
you got to get second and third opinions, and I think their positions have merit, but I don't think that you have to base it just on one opinion like that.
I completely agree. So I guess to doctor's notes.
Doctor's notes. So what I would say is that don't be afraid to get fillers thinking that it's going to put you at disadvantage for surgery in the future. I think you can still get a facelift in the future, and I wouldn't not do this for that reason.
Right, and that I say that fillers and facelifts they coexist in your aesthetic journey.
It's like dermatologists and plastic surgeons.
We coexist.
Kind of.
Maybe. But we coexist, and it's just being aware of that as you kind of enter it, and being open to the suggestion of your, non-surgical provider. Perhaps this is better fit for a surgeon to do. I can only do so much. You're limited by some of the benefits that these non-surgical procedures have, and so just making sure that there is a good oculoplastic surgeon, facial plastic surgeon, and I send out a lot for mommy makeovers too, because after babies, women need support to make their body, match their face. Mm-hmm. So making sure that your provider has referrals that they trust, I think is essential.
Agree.
35 and getting a facelift, what is that? What's the implication on the face?
Yeah, there's 55? No doubt. I'm seeing younger people come in. I saw one this week. She was in her 30s, and she's like, I think I want a facelift. I'm like, you are not ready for a facelift. And I'm surprised that people are asking for a facelift at such a young age, but They are. Rarely does someone need a facelift procedure at a young age. Now, I have done people in their 40s and they're appropriate candidates, mm-hmm. but when you're in your 30s, it's very unlikely you need a facelift. And I think people are jumping to it too quickly.
And what are the implications? Because sometimes I see, especially with facelifts, like a loss of this like lateral cheek fat pad that's almost like a signal of youth.
Not if it's done right. Like I think, yes, people talk about that, but I think it's because there's too much superficial dissection in the wrong planes. You're devascularizing the face. I really think if you do the facelift appropriately, I don't want to say appropriately, but deep plane, you respect the tissues, you respect the vascularity, that's not going to happen. And yeah, can there be a benefit starting at an earlier age? Sure, because the tissues are more elastic, they stay in place, you get great results. It's within the context of your age, but 35 is still a bit young for doing that. And also, you're relegating yourself to this life of constantly doing procedures, and there's
anesthesia risks, right? Like, aren't there like
sure, but that's not. There's a lack of mental health. Do you know what I mean by that? Like when a young person comes to me and says, "I want fillers at like 18," I'm like, you know what? Think about this a little bit. Your solution should not be the next pill, the next filler. You know, there's a portion of aesthetics and beauty that comes from within.
Yes.
And yes, there's an appropriate time to get a filler or for us to come and help you. But we're not the answer to that.
We're not the Band-Aid.
Yeah. And I think when people are starting facelifts at an early age, it's usually a telltale sign to me that there's something else going on in their life, and they're looking for me to fix that solution with a surgical procedure. So I tend to have more skepticism, caution when those people come and asking for it at a young age.
So aesthetic procedures aren't the answer for everything.
No.
So what do you tell your patients who are on an injectable journey with you, getting their PLLA or their HA? When should they stop if they are going to prepare for a facelift?
So I don't think there's any hard and fast rules. What I tell my patients is if you're going to get PLLA, I want you to be outside 6 months, your surgery outside 6 months of getting your PLLA. So if you had PLLA in the last month or two, I'm like, you know what, let's wait a little bit ideally. Is it an absolute contraindication, meaning I won't do the surgery? No, I'll still maybe do it, but I like them to be outside 6 months. With fillers, you know, same thing, but having said that, with fillers, it's not a problem because I can dissolve most of it with hyaluronidase.
If you need to.
If I need to, a week before. And it's very common for me to dissolve filler in someone's face before I do a facelift. I do that very frequently. I have them come in a week before. I dissolve it or a filler I think is going to be in my way.
That's going to be in your way. Okay. Because that's important. That's like another thing like I get from patients sometimes is, you know, I'm not going to do this because I'm going to get my facelift in a year or 2 years. But I think it's important to highlight, you know, that there was a consensus recommendation that's supporting essentially what you just said that came out from facial plastic surgeons that basically recommended that, you know, perhaps 6 months prior to the facelift, not doing anything sooner than those 6 months is appropriate, especially with things like PLLA. So for the consumer out there listening, you know, there are recommendations that are based on, you know, expert recommendations. I wouldn't just go based on the person that has, you know, the Instagram post. There are people that have thoughtfully put something together to make recommendations on when you should consider to do your fillers or when you should consider to do your skin tightening procedures. And people definitely are doing these before undergoing facelifts, and they're doing just fine. In that retrospective review of the 20 patients, none of my patients had to get their filler dissolved before their facelift. And they had filler up until 6 months before their facelift. So I think it's just important to kind of make sure that your provider is up to date with the literature and is making recommendations based on expert recommendations and consensus guidelines, not just on their experience of one patient.
Amen.
Yeah. Awesome.
I think that's it for today. So we'll see you on the next episode.
Bye.
Bye.